Treatment for non-relaxing pelvic floor dysfunction is the subject of this video. I am Dr. Shakib from Core Pelvic Floor Therapy in Irvine. Stay tuned. All right, so we've done a video on non-relaxing pelvic floor dysfunction. So non-relaxing means it's not relaxing. So if we were to categorize it, it could be non-relaxing or it could be relaxing. So we've already done a video. We're just going to talk about the treatment for non-relaxing pelvic floor dysfunction. Non-relaxing means it's hypertonic. So not necessarily everything that we do for most pelvic floor dysfunction is going to be applicable here. For example, in our office, we have this machine that is called emsella, and it does 400 kegels a minute. So for a non-relaxing pelvic floor dysfunction, I would not be suggesting that machine, because that machine really gathers all the pelvic floor area here, impacts it, not gathers it, but impacts it together, and then it allows, it's almost like contracts it and lifts, contracts and lifts, and that's how it conditions those series of muscles. So for the non-relaxing pelvic floor dysfunction, we want to skip that. We actually want to go in and work on the health of this musculature and the skeletal system connected to the pelvis. So that means the thighs, the lower back, sacroiliac joint. It involves the proper breathing. That's so huge, and it's so under discussed, really. We talk about breathing, but not the kind of breathing that involves the pelvic diaphragm. So we've done a video on that, the difference between pelvic diaphragm and pelvic floor. So we're going to make sure that we put it in the description box here. But we want to be working on really more than anything, we want to be working on the posture of the individual. So that doesn't mean sit up straight, look straight, don't lean this way or lean that way, because that's not really going to be sustained. If your brain doesn't dictate that, then as soon as you get distracted, you're going to lose it. So the real main way to address a proper posture is through postural neurology. We're going to put a link of what that's all about in the description box as well, and then go through the systematic approach of analyzing movement and really working on fine-tuning those. That means this is not going to be happening overnight, and it's not necessarily something that it is innate. It is really something we've done as babies, but it's going to be much easier to do it mechanically, I should say that. And mechanical duplication of a move is just waste of time. So if you really want to look into what I'm talking about, make sure that after you watch this video, you go to the description box and click on postural neurology and DNS. Those two links, pay attention to them. It really explains it thoroughly. Thanks for watching.